Hello everyone, I am Dr. Shoham Mukherjee and welcome back to my channel. If you are preparing for the FMGE or NEET PG exam, you already know that forensic medicine can fetch you a solid 15 marks and every mark counts. In this rapid revision video, we are going to cut through the clutter and focus only on what matters the most. High-yield one-liners, most important exam favorite topics and concepts that are frequently repeated and must know for the exam. So whether you are short on time or doing your final revision, this video is designed to maximize retention and boost your score in the minimal time. So let's get started and let's ace those 15 marks together. For this PDF, you can join my Telegram group. The link for that is given in the comment box. And one more thing, please subscribe to the channel and mention your feedback in the comment box also. So let's get started. So we'll start with general forensic. This is my Instagram ID. You can message me here, and for this PDF you can message me on Telegram also. So let's start with general forensic. What is the first sign of intrauterine death? So if a fetus has already died in the uterus, we will find a gas shadow in the aorta which can be seen as early as 12 hours. In a dead drunk person, the percentage of blood alcohol will be 0.5%. Breath alcohol can be measured by instrument known as alcometer or drunkometer. What is the minimum age for giving consent for surgery? It's 18 years. So a person aged 18 years can give consent for surgery. Who can pass a sentence of imprisonment? Judicial or first class magistrate can pass a sentence of imprisonment for up to 3 years. Oath has to be taken. So in a courtroom, oath can be taken by person who are 12 years and above. So below 12 years, no need of oath. Only 12 years and above person has to take oath. After death, benzidine test is positive for up to 150 years and bone begins to decompose after death in 3 to 10 years. Which is the first permanent tooth? It's the first molar. So first molar is the first permanent tooth. Now we can estimate the age from eruption of teeth from 17 to 21 years of age. So for a dead person, suppose we have to estimate the age from the teeth, 17 to 21 years of age, we can estimate the age. Mixed dentition is found in 6 to 12 years of age and the first permanent molar appears in 6 to 7 years. What do you mean by infanticide? Infanticide means unlawful destruction of child below 1 year of age. So if a child is killed below 1 year of age, it's known as infanticide. What is the age of consent for medical exam? In cases of rape, so if someone is raped, the victim can give consent for medical examination if she is at least 12 years of age. Rape under 18 years of age is known as statutory rape. What is euthanasia? Euthanasia means mercy killing. So only passive euthanasia is allowed in India and we have to take permission for it from the High Court. What is Joule burn? Joule burn is found in electrocution. Filigree burns are found in lightning. So these are the two names of the burns you have to remember. What is the surest sign of death? It's putrefaction. What is the surest sign of hanging? It's the dribbling of saliva from the angle of the mouth. Capacity of a person to make a valid will is known as testamentary capacity. So who can make a valid will? Like a person who has the ability to make a valid will, it's known as the testamentary capacity of that person. And any evidence, whether may it be oral or written, of a witness under oath is known as testimony. So if a witness is giving any evidence, it may be oral or written form, after taking the oath, it is known as testimony. And what is the most reliable method for determining personal identity? It's dactylography or fingerprinting. Tentative cards or hesitational cards. So hesitational cards, other name, are found in suicides. Now, death in police custody. So if anything happens in the police custody, who will investigate that? Obviously, police will not investigate that. It will be investigated by the magistrate. Human blood in stains is identified by precipitin test. Most reliable chemical test for blood is benzidine test. Best test for blood stains is chromatography, absorption, spectroscopy. You have to remember all these names. Tickman test for blood stain is hemine crystal test. Science that deals with death is known as thanatology. Now, fracture of the hyoid bone in case of a strangulation is most commonly seen in the greater horn. So, we will find fracture of the greater horn of the hyoid bone in case of any strangulation. With cannabis, we will find run amok. Most useful technique for identification from a skull. So, if a skull is found and we have to identify the person, we have to make the image of the person. So, the technique is known as superimposition technique. What is the most common type of finger impression? Loop. And what is the least common type? It is the composite one. You can find all these images from Google. These images can come as image-based questions in your exam. Inquiry into circumstances of death is known as inquest report. And a police inquest can be done by whom? The person, like the police official, should be at least at the rank of head constable. Below this rank, they cannot do any inquiry into death circumstances. Cadaveric spasm occurs immediately after death. So, this is the sign which can be seen immediately after death. Evidence speaks for itself. So, evidence will give you like the idea how the murder was done or anything, any idea. So, evidence speaks for itself. What is known as? It's known as res ipsa loquitur. Body is exhumed. Exhumed means digging it out again. Like once the body is buried, it's digged out again. So it's known as exhumation. Body is exhumed only by written order. Who can give written order to exhume the body? These three people. One is the first class chief judicial magistrate, second is the executive magistrate, and the third is the coroner. There is no time limit for exhumation in India. Anytime these three persons can give written order to do exhumation. Now, what is judicial hanging? Judicial hanging is the official method of execution for any death sentence given by the court. Now, how does the person dies? The person dies due to dislocation of the second and the third cervical vertebra. So, dislocation between these two vertebrae can cause death of the person. Where is the knot tied? Knot is tied just below the chin, and it is a simple hanging knot. It is placed at the angle of the mandible. So, this portion is very, very important. The organs that resist putrefaction are the uterus in non-pregnant uterus, and in males it's the prostate. What is algor mortis? Algor mortis is the cooling of the body, and if we plot it on a graph, we will find sigmoid or S-shaped curve. If master is responsible for the fault of his servants, it is known as vicarious liability. What does this mean? Suppose if in a hospital any doctor like commits a crime or due to doctor's negligence the patient has died, so here who is the master? Master is the employer or the hospital management, and servant means the employee. So doctor is here is considered as the servant. So if master, the hospital management, is responsible for the fault of the employer, that is known as vicarious liability. That means the master is liable for the fault of his employer. Sewer gas contains CO, methane, and HS. Ligature mark in hanging is an example of pressure abrasion. So ligature mark which is found in hanging is an example of pressure abrasion. Pathological loss of memory is known as confobulism. Now, what are the tests for semen analysis in case of any rape? It's acid phosphatase test, Barbario test, creatine phosphokinase test, and Florence test. So these are the 4 tests which we can done for semen analysis. Now coming to another important topic, firearm injuries. What is the range of an air rifle? It's 90 yards. And what is the range of military rifle? It is 3000 yards. Now dispersion of pellets. Once we fire a bullet, if the pellets are dispersed, so dispersion happens beyond 10 feet. Before that, dispersion doesn't happen. In a gunshot wound, what is the presence, like the presence of singeing of hair or charring of skin? What does it denote? It denotes that the bullet is fired from 18 inches. So it denotes the distance. These are the characteristics. If we fire from a point blank range, it will give blasting effect. Now coming to a very important topic, many questions can come. What are the types of bullets? It is very, very important. So first one is the ricochet bullet. What happens here? The bullet when fired will strike some intervening object first and then the target. Suppose the bullet it's fired, first it will strike this object and then it will hit the target. First it will strike the object, then hit the target. What is yawning bullet? It will travel in an irregular fashion causing keyhole entry in the wound. So keyhole entry is the characteristic and it will travel in an irregular fashion. What is dum-dum bullet? It's a nose cut off bullet. What is tumbling bullet? Means that bullet will rotate in end on end during motion. So it will rotate in end on end. It will rotate around itself during motion. What is souvenir bullet? Souvenir bullet means the bullet is left in the body for a long time, and with time it gets surrounded by fibrous tissue inside the body. What is tandem or piggyback bullet? Means the person is firing only one bullet, but two bullets are ejected one after the other. So that is known as tandem or piggyback bullet. What is Kennedy phenomena? Kennedy phenomena means suppose a bullet is fired to the person dies, the post-mortem is done. Now after that, if we want to identify the entrance or exit of wound, like the surgery and suturing is already done after the gunshot. So after that, if we want to identify the entry or the exit of wounds to identify the type of murder, it is known as Kennedy phenomena. By this, we can identify. Now coming to drowning. So drowning can be two types, freshwater drowning and saltwater drowning. In freshwater drowning, early death occurs, so it is also known as early death drowning. And in saltwater or seawater drowning, late death occurs. What are the characteristics? In freshwater, we will find hypervolemia, hemodilution, there is increase of potassium, decrease of sodium and calcium levels. And death occurs due to ventilation fibrillation. Whereas in salt water, everything opposite happens. Hypervolemia, here hypovolemia occurs, hemoconcentration occurs, increased level of magnesium and chloride, and increased level of sodium and calcium. Here it's decrease. And in salt water, death occurs due to asystole or cardiac standstill. So you have to identify the cause of death. In fresh water, it is due to ventilation fibrillation, and in salt water, it is due to asystole or cardiac standstill. Now, what are the postmortem signs of drowning? So here are the signs of antemortem drowning in descending order of accuracy. So the first descending order of accuracy means the first one is the most perfect, like the surest sign, and as we go down, the accuracy decreases. So if we find a person, if we find a dead person who is tightly holding in the hands grass or weeds, so this position is known as cadaveric spasm, and this is the surest sign of drowning death. Now, if we find froth over the mouth and nose and also in the air passages, it is the second best sign of drowning, like death due to drowning. What is emphysema acusum? This term means overinflated lungs. Now, if we find presence of sand or mud, etc. in the respiratory passages, especially in the terminal part, then it also means drowning death. What is diatom test? We will find presence of diatoms. There will be presence of water, especially mixed with sand or mud in the stomach or intestine. What is Patoff hemorrhage? It is subpleural hemorrhage. Pleura is the membrane surrounding the lungs. So Patoff hemorrhage is subpleural hemorrhage. What is Getter's test? We will find chloride in the heart chamber. Now, there will be signs of immersion. So first one is the washerwoman's hand or feet. So the person's hand and feet will look like a washerwoman. What are the characteristics? Like this, the skin of the palm or sole of the person. First, in 3 to 4 hours of death, we will find wrinkles over the skin of palm and sole. Then we will find bleaching, which will be found in 12 hours. Then soddening in 24 hours. And the last one, the skin or cuticle will be peeled off in 3 to 4 days. So you have to remember this sequence. We will also find cutis ulceria, like goose-like skin of the person, and flotation. Flotation is also important. So in summer time, the body will float. Like after drowning, after the death of the person, the body will come up on the surface of the water in 24 hours. Whereas in winter time, it will take 1 to 2 days. So winter time, it takes more time to float onto the surface. Now coming to the topic of toxicology, we will find pinpoint pupil in barbiturate poisoning, in cataract, in cerebropontiline hemorrhage, in opium poisoning, and in organophosphate poisoning. We will find dilatation of pupil in cyanides and datura. And also we will find constriction in physostigmine, phenol, as we already discussed, pinpoint pupil, like constriction in organophosphate and opium. Now, here are various poisons and their names. So, ideal suicide poison is cyanide. What is ideal homicide poison? Homicide means murder. Suicide means to kill oneself. Homicide means if one person is killing other. So ideal homicide poison is thallium or fluoride compounds. What is the most common homicidal poison in India? It's arsenic. Which is the poisoning which resembles cholera? So this poisoning will resemble the clinical characteristics, like clinical features of cholera, arsenic. Poison which resembles tetanus is strychnine. Poison which resembles natural death is thallium. Therefore, thallium is the ideal homicide poisoning, because if one person murders to other person with thallium, it will resemble natural death. The poison which resembles fading measles is arsenic. Poison which resembles thyrotoxicosis is binitro compounds, and the strongest corrosive poisoning is sulfuric acid. Various snake poisons. This snake will have musculotoxic effect. Viper will have hematotoxic effect. Cobra and crate will have neurotoxic effect. Antidote used in common types of poisoning snakes in India. So in all types of poisonous snakes in India, we use antidote. Cobra bite gives binocelate mark. Due to the teeth distribution, we will find a binocelate mark if a cobra bites. What is the fatal period of sulfuric acid poisoning? It's 18 to 24 hours. What are the symptoms of dhatura poisoning? All D's you can remember by this mnemonic, like dryness of mouth, dilated pupils, delirium. We can all find this in dhatura poisoning. Formication. What do you mean by formication? Like the person, it is like the other name is Magnan's symptom. The person who is cocaine dependent, who is addicted to cocaine, will complain of insects crawling on the body. There are no insects, but the person will feel like sensation of insects crawling on the body due to addiction to cocaine dependence. This is known as formication or Magnan's symptom. Now, wrist drop and foot drop may be seen in poisoning with lead, and we can also find constipation in lead poisoning. So, nail, hairs and long bones are preserved in cases of chronic arsenic poisoning. Strong sulfuric acid, like in case of acid attack, strong sulfuric acid when thrown on the face of a person, it is known as vitriol throwing. What is shaking palsy or mad hatters? It is seen with mercury poisoning. Marquis test is used in opium poisoning. To determine opium poisoning, we will use Marquis test. Dhatura is also known as road poison. Phossy jaw is produced by chronic white phosphorus poisoning. Nux vomica. Its seeds contain two alkaloids, namely strychnine and brucine. Optic atrophy occurs in methyl alcohol poisoning. Green line on the gums is a feature of copper poisoning. Diwali poisons are mercury and phosphorus. Now, you have to remember, this is an important question, various antidotes of poisonings. So, in case of atropine and dhatura poisoning, we will use physostigmine. In case of cyanide, we will use amyl nitrate. In case of strychnine, we will use barbiturate. In case of morphine, we will use naloxone. In case of methyl alcohol poisoning, we will use fomepizole. And in case of iron poisoning, we will use chelating agents like desferoxamine. Now we will study various poisons and their colors of the lividity. So carbon monoxide and HCN poisoning, the color of the lividity we will find bright cherry red. This is an important question. Potassium chloride, we will find chocolate brown. Hydrogen sulfate, blue green. Opium will be black. Phosphorus will be dark brown. Cyanide will be pink. Here I have marked QQQ. So these three are most important. Now the last topic, we will study some miscellaneous points. And with this we will end forensics. So death registration should be done in 21 days. Within 21 days of the person dying, we have to register the death with the government. Test for organophosphate poisoning is known as cholinesterase test. Summon means it is a legal document to call any person or any victim to the court. It's a legal document. Test for blood stain is Takayama test. Most reliable criteria is Gustafson's method of identification, and we can use this with the help of transparency of the root. Cadaveric rigidity follow which rules? It follows the Nisten's rule, like the 12-hour rule, which I've already studied. Miscarriage without the consent of the mother, it comes under 89 BNS. Okay, coming to BNS, I will provide you a separate PDF. Okay, I will provide you a separate PDF for all the BNS. So you can study those and revise those just one day before the exam. It will help you. I have not included any BNS, any laws in this PDF. I will provide you a separate PDF for that. McNaughton's rule is related to criminal responsibility of mentally ill. Greenish color in putrefaction is due to formation of sulf-meth-hemoglobin. So after putrefaction, we will find greenish color on the body of the person. It is due to the formation of sulf-meth-hemoglobin. What is true about gunshot wound? Like entry wound margins are always inverted and exit wounds are everted. After injury, hair bulbs are seen crushed under microscopy. What does it denote? If in the question it is given, hair bulbs are seen crushed under microscopy, it denotes that the probable type of wound is laceration. If the bullet enters the body and remains inside, like which we have already discussed, souvenir type of bullet, It can be associated with which poisoning? Lead poisoning due to the bullet remaining inside the body. Organ to be preserved for toxic analysis at autopsy along with liver and intestine is spleen. So you have to preserve these 3 organs for autopsy. Posthumous definition. Posthumous means the child is born after the death of the father. In death due to starvation, how will you identify that the person has died due to starvation? We will find that the gallbladder is distended. So distended gallbladder is a sign of death due to starvation. Supposititious child, which is also known as fictitious child, means like the woman is illegally claiming that the child is the son or the daughter of that person. So it is a fictitious child. Relevance of child to his grandfather is known as atavism. Asphyxia due to compression of neck by human hand. So if a person like tries to kill one other person or kills the person by compression of neck with his hands, it is known as throttling. The term is known as throttling. Soot particles is seen in airway due to burn. So death due to burn, we will find soot particles in the airway. In heat stroke, what are the characteristics? Skin will be warm and the sweating does not occur. Countercoup injury is seen in moving head. So if the head is in moving condition and then the injury happens, it is known as countercoup injury. Drug of choice for organophosphate poisoning: atropine, perlidoxin and benzodiazepines. Subject is dead. How will you confirm? The heart does not beat for 5 minutes. Rubbing private, this we have already discussed in the psychiatry rapid revision video. So it is a illness. Rubbing private parts against others and like gaining enjoyment, it is known as frotourism. Bad trip is a feature of LSD. Weed is another term for cannabis. Law of courtesy between doctors is known as medical etiquette. Nature of hymen in false virgin is elastic. And how will you determine like the girl is raped or not? By the rupture of the hymen position. So the most common site of rupture of hymen in rape on virgin is posterolateral. Sex play by using objects of other gender is known as paraphilia. Also, we have studied in psychiatry. Buccal coitus is also known as sin of Gomorrah. Regard states is used for testing lung maturity. Lichtenberg flower is a classical finding we will find in lightning stroke. Other name of lesbianism is tribadism. Willful medical termination of pregnancy. So if the mother is aborting on the mother's will, can be carried out till 20 weeks in India. Saturnism is a feature of lead poisoning. So with this we end forensic rapid revision. I am requesting you once again, if you like the video, if you find the video helpful, please comment down your feedback and please subscribe the video, please subscribe my channel and also share it with your friends and colleagues who need this video. You can join my Telegram group for study preparation. The link for that will be given in the comment box. Also, you can message me here on Instagram or Telegram for this PDF. And please don't forget to subscribe the channel. Thank you. Have a good day.